Hello everyone, my name is Irumva Pacific, medical student from University of Rwanda. Today I want to tell you about the anatomy of the liver. The liver is the organ which function as the industry of the body. So we can go. The liver, it is the largest solid and glandular organ in the body, and it has a wedge shape, but you will hear someone telling you that it is a triangle shape because it has three sides with three angles, and it weighs about 100 grams at the birth, and you can see here it's a contribution to the weight of the body in adults and at the birth. This organ, you can find it in the supracholic compartment, and it occupies the right hypochondrium here. By regarding the regions, you remember it, we divide the regions by the midiclavicular line and transtubercular plane and the subcostal plane, this one. So you can find it in the right hypochondrium, also in epigastric, but also a small part of the left hypochondrium, and you will see sometimes it extends inferiorly in the right lumbar regions in some cases. So the liver, externally it is divided into two lobes, right and left. So you can divide it anatomically or functionally. Anatomically it is divided by falciform ligament, this one, which also continue here as another ligaments, and you can divide it as right and left by falciform ligament. Also functionally you can divide it by inferior vena cava and the gallbladder, as right and the left. The liver has also two accessory lobes, quadrate and caudate. This one caudate and this one quadrant, and these two accessory lobes may belong in right lobe by dividing liver anatomically, and also in left lobe by dividing using inferior vena cava and gallbladder. Also we have the anomalous lobes of the liver. The anomalous lobes of the liver are Rader's lobe and supradiaphragmatic liver. This Rader's lobe, it is a tongue-like structure which extends from the right lobe by going to the left, and also have the supradiaphragmatic liver. Here it seems to be like a herniation, but not a herniation. It passes the diaphragm to the thoracic region, and it is called supradiaphragmatic liver. So regarding the surfaces of the liver has two surfaces: the diaphragmatic surface and visceral surface. The diaphragmatic surface, it is smooth and flat posteriorly and has large dome for the right hemidiaphragm and a small dome for the left hemidiaphragm. and the posterior inferior or visceral surface as the second surface of the river, marked by the H arrangement. We are going to see about this H-shaped arrangement. The boundaries of this H-shaped arrangement is right rim and left rim. Right rim with the subdivisions of right anterior and right posterior limb, and left anterior and left posterior limb, but also horizontal limb. The right anterior limb contains the gallbladder fossa. It is a gallbladder fossa, and that the right posterior limb is a groove for inferior vena cava. Left anterior limb it is a fissure for ligamentum teres, and the left posterior limb is a fissure for ligamentum venosum. So regarding two horizontal limb, we can talk also about the hiram, that horizontal limb. Yeah, also it is you can call it a hiram. It is also called the potohepatis, as you have seen here. Horizontal limb, it is the potohepatis. So it transmits the portovein branches of the hepatic artery and hepatic duct from the posterior to anterior. You know the portotriad: portovein, hepatic artery, and hepatic duct. So this hiram transmits this vein and artery, also the ducts. This poto is enclosed in the rasa omentum attached to the ligamentum venosum in the fissure. Of course, we are going to see its structure. You will understand it. The river is completely covered by fibrous capsule. I think you know this fibrous capsule, also we call it Grisson's capsule. Partially covered by peritoneum with the exception of barrel area. In the next slides, we will see about the bell area. You will understand it. So this is the structure. You see the right limb, the left limb here, and the right anterior limb with gallbladder, and the right posterior limb, inferior vena cava, and the left anterior limb, the fissure for the ligamentum teres here, as a continuation of the falciform ligament, and the left posterior limb as a fissure for the ligamentum venosum. And this is the hiram or horizontal limb, or potohepatis. So it transmits the vein, the branches of artery, hepatic artery, and also hepatic duct. This one, duct. Yeah. So that this is the H-shaped arrangement of the visceral surface. So we can also take a look on the supports of the river. The river, it is supported by the anatomic and non-anatomical supports. The anatomical supports, it is inferior vena cava, suprahepatic veins, several ligaments like a falciform ligament which connect the liver to the anterior abdominal wall, triangular ligament, coronary ligament, and round ligament. This ligament we are going to see it in the next slides, and the peritoneal folds. And the anatomical supports, it is a positive intra-abdominal fissure. So we are going also to see about the liver segments. Maybe you have heard about the segments of the liver, but to divide the segments of the liver, we base on the blood supply, yes, blood supply and blood drainage, of course. Here you see, this is the vena cava, and this is its branches, which drains into the vena cava. And also you can see here, this is the portal vein, and the inferior vena cava has the right hepatic vein, this one which divides the liver into anterior and posterior, this is posterior. And we have also middle hepatic vein which divides the liver into right and left, and also left hepatic vein, this one which divides the liver into lateral and medial, this one. And also we have the portal vein which divides the liver into upper and lower segments. So that's why we have these names. The first segment, it is called the caudate lobe. You remember the caudate lobe? It is somehow posteriorly. This one here, you can see this one. That is the first segment. And the second is left superior lateral segment. Remember, lateral and medial. Lateral, and here it is left superior because it is in the upper segments. Left superior and lateral segment. So, and also you can have left inferior lateral segment. So you name it accordingly to how these veins divide it. So that's why here we will have the left superior medial segment and left inferior medial segment, and here we will have a right inferior anterior segment, right. Here we have right superior anterior segment. Here, as I said, it is posterior here. It is divided by the right hepatic vein into posterior and anterior. Here it is a right inferior posterior segment. Here it is a right superior posterior segment. I think it is understandable. You can see it. Also look at this. I think it is clear. You can see it. Yeah. First segment, second, third, fourth A and fourth B. 5, 6, 7, and 8. Uh, uh, the 6 and 7, it is posteriorly, while 5 and 8 it is anteriorly. Some ones like to be confused in these segments, because here it is 5, here it is 6, so the 6 and 7 are posteriorly. So now we can move to ligaments of the liver. Ligaments of the liver. I think I have used to say some of them. Here it is a falciform ligament. We are going to regard on this ligament, falciform ligament, this one, in order to localize or to know other ones. This is the falciform ligament. It extends from an anterior surface to the diaphragm. Yeah, here, anterior surface here to the diaphragm, anterior surface to the diaphragm, and anterior abdominal wall. Yeah, as I said, it attaches a liver to the anterior abdominal wall. Falciform ligament has left and right reef. When it reaches here superiorly, it divides into right and left reef. So the left reef gives us the left triangular ligament. Here it is a continuation of the left reef, it comes here and bends and gives us the triangular ligament. It contains the blood vessel. This ligament contains the blood vessels, aberrant bile duct, cords of hepatocytes, and nerves. The right leaf here, as it continue here, it gives us 3 ligaments. Superior, you have the superior layer of coronary ligament, this one which extends up to here, this one coronary, yeah. But also we have the inferior layer here, which extends also here to here, and also right triangular ligament. Right triangular ligament, it is formed by the fusion of superior and inferior coronary ligament, and this form the bare area. Bare area, it is this area in between the coronary ligament, this one, and by clinical correlates of this bare area, it transmits the infections in lymphatics to the thoracic region. So let's also talk about the species of the liver. Species of liver. By regarding the species of the liver, we have suprahepatic or subphrenic species here, which extends only like this, and also we have infrahepatic space, which is also divided into 2. The suprahepatic or subphrenic space is divided into 2 by falciform ligament, right and left. Yeah, this is the lateral view. We cannot see it very clear, but it is divided into right and left by falciform ligament. So also we have infrahepatic space, which is divided into 2 also, right and left, This is left and this is right. You see, right here. The right infrahepatic space, this one, is also called Morrison pouch. This Morrison pouch, and it is between the right part of the liver and right kidney, and also spleno gland. You see the right kidney here, and spleno gland, it is above the kidney. You see it is between the liver and the right kidney. Okay. Also, you have the left infrahepatic space, which is further divided into smaller antegastric and larger laser sac of peritoneum. So these are species of the liver. So let's look on the neurovascular supply of the liver. We have dual blood supply of the liver by portal vein, hepatic artery. The portal vein give blood, the high level of the blood supply to the liver. It brings about 75 to 80% of the blood into the liver, and hepatic artery also brings between 20 to 25% of the blood into the liver. There's a vein and the artery. They supply bloods. They do not drain. Even though this is the vein, the portal vein is a vein. It supply. It brings the blood from the GIT to the liver in order to be filtered or be detoxified. The portal vein, it is a fusion, or it is a continuation of two veins. One, it is splenomesenteric vein. Why it is called the splenomesenteric vein? It is the inferior mesenteric vein which join the splenic vein and form a larger vein called the splenomesenteric vein, and also the superior mesenteric vein at the posterior neck of pancreas. This is where they meet and form the larger portal vein, which brings high supply to our liver. So and also we have the hepatic artery. This is the proper branch of the the celiac trunk. Celiac trunk, if you remember. Celiac trunk gives us three branches. In these three branches, there is a common hepatic artery. Common hepatic artery which gives us right gastric artery, goes to the stomach, and also gastroduodenal artery, but also proper hepatic artery. This proper hepatic artery, it is which goes to the liver and brings 20 to 25% of the blood into the liver. This ranges isn't the blood isn't the blood about the blood of about all the blood of circulatory system. No, it is about the blood in the liver. Blood in the liver It contains 75 to 80% of portal vein and 20 to 25% of hepatic artery. So, by regarding the drainage, the river is drained by hepatic veins with three. There are three: right, middle, and lateral. They drain the filtered and detoxified blood from the river into inferior vena cava and continue into the system to heart. By regarding the lymphatic drainage, the lymph vessels leave the river and enter several lymph nodes in the portal hepatis. Here, there is you cannot say the lymph drainage from the river goes to in only one line of the vessels. Yeah, it goes to different places. The efferent vessels pass to the celiac nodes. A few vessels pass from the bell area, remember? From bell area of the river through the diaphragm to the posterior mediastinal lymph nodes, and here the infections also can pass through this lymph to the posterior mediastinal lymph nodes in thoracic. Few vessels drain to left gastric node, parasternal nodes, umbilicus, and anterior abdominal wall. So regarding to the nerve supply, we have sympathetic and parasympathetic nerve supply from celiac plexus. The anterior vagal trunk gives rise to large hepatic branch which passes directly to the river. Parasympathetic via vagus nerve and sympathetic which form these two forms celiac plexus. So that was the neurovascular supply of the river. So regarding the relations of river, anteriorly the river is related to the diaphragm, superiorly. Right and left costal margins, right and left pleura, and lower margins of both lungs, xiphoid process in the epigastric region, and anterior abdominal wall in the subcostal angle. Posteriorly, the diaphragm, right kidney, hepatic flexure of the colon, where the ascending and the transverse colon meet, duodenum, gallbladder, inferior vena cava, and esophagus, and also fundus of the stomach. So clinical correlates to this organ, we have hepatomegaly. Hepatomegaly, it is enlargement of the liver due to the hepatic engorgement. When massively enlarged, its inferior edge may be readily palpated below the right costal margin and may even reach the pelvic brim in the right lower quadrant of the abdomen. We have also cirrhosis of the liver, characterized by the hepatomegaly and hobnail appearance of the liver surface resulting from the fatty changes of and the fibrosis. Maybe I have some structures about the fatty liver and the fibrosed liver, so you will see it. Accessory or aberrant hepatic duct. Accessory or aberrant hepatic ducts, they are common and they are in position of danger during cholecystectomy. Cholecystectomy is the removal of the gallbladder. Hepatic lobectomies and segmentectomy, and this is very important. If there is a cancer which infect one segment, you can remove it by segmentectomy, sorry, so that the liver can regenerate and continue its function. Lobes can be removed or segments in trauma and cancer. Liver transplantation. So this is a fibrotic liver, cirrhotic liver, and liver with a cancer. You see the healthy liver, and you can compare it with these infected livers. So addition. You may be asked to locate the liver by regarding to your body. So the liver, you can locate it by regarding the nipples of the breast, this one. So there is 3 points: A, B, and C. A, B, and C. So point A, it is belong the right nipple 1 centimeter below the right nipple. Point B, it is 2 centimeter inferior medial in the 5th intercostal space, and point C, this one, point C in the right costal margin at the anterior axillary line here. So thank you so much for being with me in this video. Best wishes to you and your families. So this is interestable, you can read it.